Welcome to episode 50 of the Peak Performance Podcast by Brad Young. In this episode, we explore the often overlooked aspects of stem cell therapy recovery and how to optimize your healing process. From managing unexpected pain to implementing effective rehabilitation strategies. This guide shares personal experiences with patella and shoulder recovery, practical exercises, and complementary therapies that enhance stem cell effectiveness. Whether you're considering stem cell treatment or currently recovering, these insights will help you navigate the path to peak performance through regenerative medicine. Understanding the stem cell recovery process. When I decided to undergo stem cell therapy for my knee and shoulder injuries, I was prepared for the procedure itself, but not fully aware of what recovery would entail. Stem cell therapy is a revolutionary approach to healing that utilizes your body's own regenerative capabilities, but the journey to full recovery isn't always straightforward or widely discussed. The therapy works by introducing stem cells, undifferentiated cells capable of developing into various specialized cell types, into damaged tissues. These cells then begin the process of regeneration, replacing damaged cells and promoting healing. What most medical professionals don't emphasize enough is that this regenerative process can be uncomfortable and requires patience. Initial injection phase. Procedure completed with minimal discomfort under local anesthesia. The actual injection process is relatively quick, though preparation may take longer. Acute recovery, days 1 through 7. Significant inflammation and discomfort as stem cells begin their work. This is when most patients experience the pain no one talks about. I had significant pain during the first 10 days. Be prepared for being in pain, and I could not raise my arm, so I used full size bath wipes most of the time because you do not want to slip and fall in the shower. I could do some computer work, but be prepared to be still and be very careful during this period. Early healing, weeks 2 to 4. Gradual reduction in acute pain, though discomfort during movement persists. First signs of functional improvement may appear. During weeks 2 to 4, my knee got significantly better. My knee still lacks range of motion, and my shoulder is still hurting and swollen in the bicep tendon and rotator cuff. I can still feel pain in the labrum and cannot do dead hangs in week 4. Before the stem cell injections, I could do 38 good full pull ups with a 20 lbs vest on after a 5-mile run. So it will be interesting to see how quickly I get my strength back. Progressive healing, months 2 and 3. This is where I hope to see some serious progress because you are supposed to see more noticeable improvements in function and reduction in pain. Different injury sites heal at different rates based on various factors. Long-term recovery, month 4 onward. Continued healing and strengthening. Stem cells continue their regenerative work for up to 12 months after treatment. Understanding this timeline will help me manage my expectations and prepare mentally for the recovery journey. What surprised me most was how different the recovery experience was between my knee and shoulder, a crucial aspect I'll explore in the following sections. The untold pain. What medical professionals don't emphasize. One of the most significant gaps in stem cell therapy education is the frank discussion about pain during recovery. When I underwent the procedure, I was told there would be some discomfort, but this understated the reality of what I experienced, particularly in the first few weeks. The pain during stem cell recovery isn't just from the injection site, it's the deep, sometimes intense sensation of your body actively rebuilding tissue that can be surprising and concerning if you're not prepared for it. During the first week post-treatment, I experienced throbbing sensations in both my knee and shoulder. This wasn't the sharp pain of injury, but rather a deep, persistent ache that would intensify with certain movements or at night. What I later learned is that this pain is actually a sign that the stem cells are actively working. Inflammation is part of the healing process as new cells form and integrate with existing tissue. Another aspect rarely discussed is the emotional journey. There were days when progress seemed non existent and the discomfort made me question my decision. This psychological component of recovery can be as challenging as the physical pain, especially when improvements aren't immediately visible or tangible. Common pain experiences: deep throbbing ache at the injection site that may radiate to surrounding areas, temporary increases in stiffness, particularly in the mornings, sharp twinges during specific movements as new tissue forms, muscle soreness from compensatory movements, occasional nerve sensations like tingling or electrical feelings. Pain management strategies: cold therapy for acute inflammation, gentle heat therapy after initial inflammation subsides, prescribe pain management protocol, avoid anything anti inflammatory, adequate rest balanced with appropriate movement. It's crucial to maintain open communication with your healthcare provider about pain levels. While some discomfort is expected and even necessary, severe or increasing pain could indicate complications that need attention. The key is distinguishing between healing pain and problematic pain, something I had to learn through experience. My pain in my shoulder was still there 30 days in. A Tale of Two Recoveries: Knee versus Shoulder Healing. My experience with stem cell therapy revealed a fascinating contrast between how different joints respond to treatment. The recovery trajectories for my knee and shoulder were remarkably different, providing valuable insights into how factors like injury age, joint complexity, and blood supply affect healing. My knee, specifically the patella kneecap, responded exceptionally well to the stem cell treatment. Within just a few weeks, I noticed significant improvements in mobility and reduction in pain. By the 2-month mark, I was able to perform light exercises with minimal discomfort. The regrowth of cartilage in the patella region was confirmed during follow up imaging, showing remarkable tissue regeneration that exceeded my doctor's expectations. In contrast, my shoulder recovery has been considerably slower and more complex. The injury was much older, dating back several years compared to my more recent knee injury. This older damage presented a more challenging environment for the stem cells to work with, as chronic injuries develop more scar tissue and adaptive patterns that must be addressed. Knee recovery highlights: newer injury, less than 2 years old. Patella injury from a fall and was hit by a SUV while running. Excellent blood supply to the patella region. Simpler joint mechanics. Visible improvement within 3 to 4 weeks. Shoulder recovery challenges: older injury with several years of damage, complex rotator cuff involvement and labrum tear, more limited blood supply to certain areas. Slower visible improvement. I am still in pain 30 plus days later. Required more intensive complementary therapies. I purchased a shockwave machine to help with recovery after day 30, and it really has made a difference. I also purchased a massage chair to help with recovery, and it has made a significant positive impact on my soreness and flexibility. This stark difference taught me an important lesson about stem cell therapy. The age of an injury significantly impacts recovery time and outcomes. Fresh injuries with minimal scar tissue respond more quickly, while chronic conditions require more patience and supportive therapies. Additionally, the shoulder's complex structure, involving multiple muscles, tendons, and a wide range of motion, creates additional challenges for healing compared to the more straightforward mechanics of the knee joint. Understanding these differences helped me adjust my expectations and recovery approach for each joint. It also highlighted the importance of addressing injuries promptly rather than allowing them to become chronic problems that are more difficult to resolve, even with advanced treatments like stem cell therapy. Optimizing knee recovery, targeted exercises, and protocols. The remarkable regeneration of my patella through stem cell therapy was not a passive process. While the stem cells provided the biological foundation for healing, I discovered that specific, carefully structured exercises significantly enhanced the recovery process. These exercises were designed to stimulate blood flow to the area, strengthen supporting muscles, and gradually restore full function without disrupting the healing tissue. Before beginning any exercise program during stem cell recovery, I consulted with my physical therapist to create a protocol specifically tailored to my condition. This professional guidance was crucial, as the timing and intensity of exercises needed to be precisely calibrated to the healing stage. Phase 1 knee. Gentle activation for 2. Week 1, you will not want to walk around much at all. The swelling was still in my knee on day 30. Focus on maintaining mobility without stress in the injection site. These exercises use minimal resistance and controlled movements. Heel slides while lying on back, 3 sets of 10 twice daily. Quad sets, gentle contractions without movement, 5-second hold, 10 reps, 3 times daily. Ankle pumps to maintain circulation, 20 reps every hour while awake. Phase 2, progressive loading, weeks 3 to 6. Gradually introduce more resistance to stimulate tissue growth and strengthen supporting muscles. Straight leg raises in 4 directions, 3 sets of 10. Each direction daily. Seated knee extensions with light resistance, 3 sets of 12 every other day. Standing calf raises for circulation, 3 sets of 15 daily. Stationary bike with minimal resistance, 5 to 10 minutes, gradually increasing. Phase 3, functional restoration, weeks 7 to 12. Focus on movements that mimic daily activities and begin to restore normal biomechanics. Mini squats progressing to quarter squats, 3 sets of 12 every other day. Step ups onto a low platform, 3 sets of 10 each leg every other day. Balance exercises on stable then unstable surfaces daily. Swimming or water walking for low impact conditioning, 20 to 30 minutes, 3 times weekly. Throughout all phases, I maintained strict adherence to pain boundaries. Exercises should cause no more than a 3 out of 10 discomfort level that subsides quickly after completion. If pain persisted for more than an hour after exercise, I would scale back the intensity or volume at the next session. Equally important was the integration of proper warm up and cool down routines. Before exercises, I would apply gentle heat to increase blood flow and tissue elasticity. Afterward, I would use controlled cold therapy, 10 minutes maximum, to manage any inflammatory response. This approach created an optimal environment for the stem cells to continue their regenerative work while gradually restoring full function to my knee. The results were remarkable. By month 4, my knee function had improved to nearly 90% of my pre injury capacity, with continued improvements expected as the stem cells continued their long term healing effects. Shoulder rehabilitation, overcoming chronic injury challenges. Rehabilitating my shoulder after stem cell therapy presented unique challenges compared to my knee recovery. The older nature of the injury combined with the shoulder's complex biomechanics required a more nuanced and patient approach. While progress was slower, I developed a comprehensive strategy that has gradually yielded improvements, even though full recovery is still ongoing. The shoulder joint involves multiple muscle groups working in precise coordination. The rotator cuff muscles, deltoids, trapezius, and various stabilizers all play crucial roles. This complexity means that rehabilitation must address not just the primary injury site, but the entire kinetic chain that affects shoulder function. Early recovery exercises, weeks 1 to 4. Pendulum swings, small gentle circular motions with arm hanging relaxed. 3 sets of 10 in each direction, 3 times daily. Scapular retractions, gently squeezing shoulder blades together while sitting, 10 reps with 5-second hold, 3 times daily. Assisted range of motion, using opposite arm to guide injured shoulder through pain-free motion, 5 to 10 minutes twice daily. Isometric holds, gentle pressure against immovable object in various positions without moving the joint, 5-second holds, 5 reps in each position twice daily. Progressive rehabilitation, weeks 5 to 12. Wall slides, standing facing wall, sliding hand up wall to tolerance, 3 sets of 10 daily. External rotation with light resistance band, elbow at side, rotating forearm outward, 3 sets of 12 every other day. Crossbody stretching, gently pull an arm across chest to stretch posterior shoulder, 30-second holds, 3 repetitions daily. A critical insight I gained during a shoulder recovery was the importance of addressing fascial restrictions and trigger points in the surrounding tissues. These restrictions, which developed over years of compensating for the original injury, limited the effectiveness of the exercises until they were properly addressed through manual therapy techniques. Unlike my knee recovery, which followed a relatively linear improvement pattern, my shoulder recovery has progressed in waves, periods of noticeable improvement followed by plateaus that required patience and persistence. This pattern is common with older injuries and more complex joints, as the body needs to relearn proper movement patterns while the stem cells work to regenerate tissue. A key discovery in my shoulder rehabilitation was the importance of proper sleeping positions. Avoiding sleeping on the affected shoulder and using appropriate pillow support prevented nighttime compression of the healing tissues and significantly reduced morning stiffness and pain. While my shoulder recovery has been slower than my knee, consistent application of these exercises combined with the complementary therapies discussed in later sections has produced steady improvements. 6 months post treatment, I've regained approximately 75% of my shoulder function with continuing progress, a significant achievement considering the chronic nature of the original injury. Complementary therapies, enhancing stem cell effectiveness. Through my recovery journey, I discovered that stem cell therapy doesn't exist in isolation. Its effectiveness can be significantly enhanced through complementary treatments. Two approaches in particular made a substantial difference in my recovery trajectory: shockwave therapy and regular massage therapy through a high quality massage chair I purchased specifically for this purpose. Shockwave therapy. Shockwave therapy uses acoustic pressure waves to stimulate metabolism and enhance blood circulation in targeted tissues. When combined with stem cell therapy, it creates a synergistic effect that accelerates the healing process. It increases blood flow to treatment areas, delivering more nutrients to healing tissues, breaks down calcifications and scar tissue that can impede recovery, stimulates cellular metabolism, enhancing the activity of the transplanted stem cells, triggers the release of growth factors that support tissue regeneration. And I began shockwave treatments 3 weeks after my stem cell injections, receiving 1 session per week for 6 weeks. The treatments were particularly effective for my shoulder, where breaking down long standing adhesions proved crucial for progress. Therapeutic massage. Investing in a high quality massage chair proved to be one of my best recovery decisions. Regular massage therapy offers numerous benefits that complement stem cell treatment, reduces muscle guarding and compensatory patterns that develop around injuries, improves lymphatic drainage to reduce swelling and promote waste removal, increases tissue oxygenation and nutrient delivery, releases endorphins that naturally reduce pain perception, provides convenient daily therapy without requiring appointments. I use the massage chair daily, starting with gentle settings and gradually increasing intensity as healing progressed. The ability to target specific areas and adjust pressure precisely made it an invaluable recovery tool. The timing of these complementary therapies is crucial. I waited until the initial acute inflammation phase had passed, approximately 2 to 3 weeks post treatment, before introducing shockwave therapy following my doctor's guidance. The massage chair was used more cautiously at first, avoiding direct pressure on injection sites until they had fully healed. Beyond these two primary approaches, I also incorporated other complementary practices that supported overall recovery. Nutritional support. Increased protein intake to provide building blocks for new tissue. Anti-inflammatory foods rich in omega-3 fatty acids. Collagen supplements to support connective tissue repair. Adequate hydration to optimize cellular function. Sleep optimization. Consistent 8-hour sleep schedule. Specialized pillows to support proper joint positioning. Relaxation techniques to improve sleep quality. Limiting screen time before bed to enhance melatonin production. The integration of these complementary approaches created a comprehensive recovery environment that maximized the regenerative potential of the stem cell therapy. While the stem cells provided the foundation for healing, these additional therapies created optimal conditions for them to function effectively. Long-term healing, what to expect beyond the first month. One of the most remarkable aspects of stem cell therapy that isn't widely discussed is the continued healing that occurs well beyond the initial recovery period. While conventional treatments often reach their maximum effectiveness within weeks, stem cell therapy initiates a regenerative process that continues to improve outcomes for months and even years after treatment. My experience revealed that the first 30 days, while critical, represent only the beginning of the healing journey. Understanding the long term timeline helped me maintain realistic expectations and recognize progress even during periods when improvements seemed to plateau. Months 1, initial tissue regeneration and inflammation reduction. Most patients notice the first significant functional improvements during this period. For me, this was when my knee showed dramatic improvement while my shoulder began showing initial signs of recovery. Several factors influence this long term healing process. Factors that enhance long term healing: consistent adherence to rehabilitation protocols, proper nutrition and hydration, adequate sleep and stress management, avoiding overuse or re injury of the treated area, maintaining overall physical fitness. Signs of continued healing: gradual increases in pain free range of motion, improved strength and endurance in the affected area, reduced need for pain management strategies, ability to return to activities that were previously limited, decreased frequency of bad days or flare ups. My experience with both knee and shoulder recovery has taught me the importance of patience. During this extended healing process, there were weeks when progress seemed stalled, only to be followed by sudden improvements. This nonlinear pattern is normal and reflects the complex biological processes taking place as stem cells continue their regenerative work. The most valuable lesson I've learned is that stem cell therapy isn't a quick fix. It's an investment in long term healing that requires patience, consistency, and trust in the body's remarkable ability to regenerate when given the right support. By maintaining this long term perspective, I've been able to appreciate the gradual but significant improvements in both my knee and shoulder function, even as the healing trajectories for each joint have differed considerably. Mental resilience, the psychological aspects of recovery. The journey through stem cell therapy recovery involves not just physical healing, but also significant mental and emotional challenges. This psychological dimension of recovery is rarely discussed in medical consultations, yet plays a crucial role in overall outcomes. My experience taught me that developing mental resilience was as important as following physical rehabilitation protocols. The recovery process after stem cell therapy isn't linear. It involves ups and downs, periods of noticeable improvement followed by plateaus or even temporary setbacks. This unpredictable pattern can be emotionally taxing, especially when expectations for quick results aren't met. I found myself navigating a range of emotions throughout my recovery journey. Initial optimism, the excitement and hope that comes with starting an innovative treatment, often accompanied by high expectations for quick results. Doubt and uncertainty, questions about whether the treatment is working, especially during periods when progress seems stalled or pain persists. Patience development, learning to recognize subtle improvements and understand the long term nature of stem cell healing. Acceptance and adaptation, adjusting expectations and finding ways to work with the body's healing timeline rather than fighting against it. Empowerment and growth, developing confidence in the recovery process and taking an active role in supporting healing. Several strategies proved invaluable in building the mental resilience necessary for this journey. Mindset practices, keeping a recovery journal to document even small improvements. Practicing mindfulness meditation to manage pain perception. Setting realistic micro goals rather than focusing only on end results. Celebrating progress milestones, no matter how small. Developing patience through deliberate practice and perspective taking. Support systems, maintaining open communication with healthcare providers, educating family and friends about the recovery process, considering professional psychological support when needed, finding communities online or in person for shared experiences. One particularly effective approach was reframing pain and discomfort as signs of active healing rather than problems to be eliminated. This cognitive shift helped me develop a more constructive relationship with the sensations I experienced during recovery. Instead of becoming discouraged by discomfort, I learned to interpret it as evidence that my body was actively working to heal, a perspective that transformed frustration into patience. Recovery is not just a physical process, but a mental journey of patience, acceptance, and growth. The mind's ability to support or hinder healing is powerful. Cultivating resilience may be the most important skill you develop during stem cell therapy recovery. The mental resilience developed through this process extends beyond recovery from stem cell therapy. The patience, perspective, and self awareness cultivated during this journey have applications in many other aspects of life and performance. In many ways, the psychological growth that accompanies physical recovery may be one of the most valuable long term benefits of the entire experience. Becoming your own recovery expert. Key takeaways. Throughout my stem cell therapy journey for both knee and shoulder injuries, I've learned that becoming an active participant in your own recovery is essential for optimal results. While medical professionals provide the treatment and guidance, the day to day management of recovery falls largely on the patient. This final section distills the most important lessons from my experience to help others navigate their own regenerative medicine journeys more effectively. Listen to your body's signals. Learn to distinguish between productive healing pain and problematic pain that might indicate complications. Your body provides constant feedback. Developing the ability to interpret these signals accurately is crucial for adjusting activity levels appropriately and knowing when to seek additional medical guidance. Consistency trumps intensity. Regular moderate rehabilitation efforts produce better results than sporadic intense sessions. The daily commitment to gentle, appropriate exercises creates the consistent environment stem cells need to thrive. This applies equally to complementary therapies like massage and nutritional support. Patience is a recovery skill. Understanding the biological timeline of stem cell healing helps manage expectations and maintain motivation during plateaus. Recovery is rarely linear. Learning to recognize and appreciate incremental improvements sustains momentum through challenging periods. Integrate multiple approaches. Stem cell therapy works best when supported by complementary treatments and lifestyle factors. The synergistic effect of proper nutrition, sleep, stress management, and targeted therapies like shockwave treatment creates an optimal healing environment. And perhaps the most important insight from my experience is that recovery from stem cell therapy is highly individualized. The same treatment can produce different timelines and outcomes based on factors like injury age, tissue type, overall health, and individual biology. This variability means that becoming attuned to your own body's responses is more valuable than strictly following someone else's recovery timeline. For those considering or currently undergoing stem cell therapy, I recommend creating a comprehensive recovery plan that addresses all dimensions of healing. Physical dimension, appropriate progressive exercise protocols, complementary therapies like massage and shockwave, proper nutrition and hydration, adequate rest and sleep optimization, pain management strategies that don't interfere with healing, mental emotional dimension, realistic expectation setting, progress tracking systems, stress management techniques, support network development, mindfulness, and pain perception management. As I continue to experience improvements beyond the initial recovery period, I'm convinced that stem cell therapy represents a revolutionary approach to healing that aligns perfectly with the principles of peak performance. Rather than merely masking symptoms or providing temporary relief, it addresses the root causes of dysfunction and leverages the body's innate regenerative capabilities. The journey through stem cell therapy recovery is a profound lesson in the body's remarkable capacity for healing when given the right environment and support. By becoming an active, informed participant in this process, you transform from a passive patient into the primary architect of your own recovery. This approach to recovery, patient, comprehensive, and integrated, doesn't just heal injuries, it builds a foundation for long term performance and resilience that extends far beyond the specific conditions being treated. In many ways, the principles that guide effective stem cell recovery are the same principles that underlie peak performance in any domain: consistency, patience, integration, and a deep respect. I will update you all on day 60 as I continue to work to find information that will help others. Thanks for listening to the Peak Performance Podcast. Please like and subscribe.